Disclaimer. This episode of the Dr. Cuterus podcast has mentions of self-harm and suicide. Listener discretion advised. Did you know that PMS symptoms can even make you suicidal? सोच में पड़ गए? बेहतरीन. That is the point of this new podcast. We want to make you think. Think about the world, think about your body, and think about science. My name is Dr. Tanya. You might know me better as Dr. Cuterus, and welcome to the Dr. Cuterus podcast. And in today's special episode, we have with us Dr. Esha Chainani. Dr. Esha is a gynecologist based out of Mumbai who runs a social media account called Prema Health aimed at helping pregnant people and women of all ages with their gynecological questions. Esha today will be talking with us all about PMS and answers all of the questions we've had about it, plus gets into the dark side of PMS, and we will be talking about PMDD too. Hi Esha, welcome to the podcast.
Hello. I'm so happy to be here.
Thank you for being here. I want to start with a very simple question. What do you do?
Okay, so I'm a gynecologist and I also started a non-profit called Prema that helps pregnant women get more access to life-saving information for pregnancy and contraception that can eventually help save their lives and help reduce maternal mortality.
I love that. So you're super passionate about what you do.
Yes.
Now, how I stumbled upon your work was also from discussions of PMS and PMDD. So this is going to be a bit more of a serious episode, I suppose. Normally we're just happy and chatting and he on this podcast. But this is, such an intense topic and there's such a serious lack of information around it. How often do you see people with pretty intense PMS? Let's discuss PMS first.
Yeah, I think first of all, I'm very happy that we're discussing this because it's made a lot of fun of. It's trivialized a lot. So a lot of times most discussions with PMS are he kind of conversations. And especially with pop culture and all of these teen movies, things like that, it becomes very, very like a joke. And you're PMSing, or she's on her period, she crazy. But it's very real. And I think a lot of us don't realize how real it is. So statistics say that 3 out of 4 women experience PMS in their lives.
Oh, wow. So PMS is a very real thing then.
It's a very real thing. It's a very common thing. And again, depending on how bad it is or how severe it is, a lot of times different people also react to pain differently. That doesn't mean that if you and I are feeling the same pain and I am finding it more painful, that doesn't mean that there's something wrong with me. It's just that we need to address that pain as equally as we address anything else.
Absolutely. I find it very important because, we've discussed this on this podcast before as well with Dr. Deepthi. Women's pain often tends to get diminished, minimized actively in some way. And PMS is a very good example of it because like you mentioned, PMS is just made fun of and it's what is it? If anybody's ever angry, are you PMSing? So what causes, why do we have PMS? How do these changes come about in the body? And what are the most common symptoms? What is PMS that way?
So PMS basically is premenstrual syndrome. So that means that we have symptoms like stomach cramps, bloating, sometimes breast tenderness, mood swings, changes in, your body. Sometimes you gain a little bit of weight as well. Sometimes you have GI issues. So some people may experience diarrhea. Some people may have constipation. All of these things. Sometimes a little bit of anxiety can also increase. We have a lot of these symptoms that come in, and this myriad of symptoms together is called PMS.
And when does one experience this?
Now, this happens around your period. A lot of times it can start up to even a week before your period and go on till the duration of your period. And sometimes it can last even a little bit beyond that.
Oh, wow. Okay. And what are the common, how do I know that my PMS is oh yeah, this is normal PMS, this is physiological, this is something that will happen inevitably because you're going through periods. When do I know that this is alarming and I need to see somebody? This is not normal.
This is something that's so subjective. Again, a lot of times, as you mentioned, how women's pain was minimized, so were a lot of these symptoms. Even with menopause, it's normal, it happens to everybody, but that doesn't mean that everybody has to suffer through it. Even it's the same with PMS. It may happen, as we said, to 3 out of 4 people or almost everybody. Some people may have symptoms that are bad. Some people may have symptoms that are manageable. At the end of the day, that is something that can only be decided by you. So if it interferes with your daily life, if it causes a lot of change where you cannot go about your daily activities, I would say that is severe PMS and needs to be addressed.
Excellent. So I believe that should be helpful for people to understand because, it's so difficult when what is normal and what is not normal. It can be so difficult to even find out for yourself what doesn't feel normal. And PMS often can be so disturbing for so many people. Like, so many people get so concerned about breast tenderness. They come with breast pain. They come to the hospital very, very often. What are the more common complaints you see in the hospital when people complain with PMS or like dysmenorrhea, if you want to get into that as well?
So actually, the most common thing is dysmenorrhea, which is the cramps, a lot of the back pain, a lot of thigh pain, tiredness, fatigue. I think those are the most common ones. And also those are the most overlooked ones because you're just expected to have these issues because you're on your period. And it's just like, ye to hona hi hai na, like you're on your period, itna to hona hi hai. And, a lot of even cramps, a lot of people believe that you just should suffer through them.
That is so horrid. Nobody says that about a headache, no? Ki headache ki dawai kha li to, I don't know.
Infertility ho
jayegi. See, anything that makes women comfortable, there's just, I go off on a tangent again every time I talk about this, but everything that is there for women's comfort is just like, infertility, uterus सूख जाएगा, flow बंद हो जाएगा. अरे flow कम हो रहा है तो अच्छी बात है ना? Your horrible period feels a little bit better. How is that a bad thing? And very often, these PMS symptoms can be seriously affecting your mood. For example, you can feel extremely like cranky, which is often the joke, cranky, irritable, exhausted, mentally lethargic. How does all of this happen? Like, what causes PMS?
So what causes PMS, and we don't really even know for sure this is the cause, but it's something to do with our hormones and how our body reacts to it. Now, I think what we've come to realize is every individual reacts to even your own hormones very differently. Yeah. Now, when we have the menstrual cycle, it's a very delicate up and down of hormones like progesterone and estrogen, which then trigger other hormones like LH and FSH, and it's a bunch of hormones working in like a very intricate dance in that sense to make your menstrual cycle. During your period or just around your period, these hormones are in a higher amount, which then get converted sometimes into these PMS symptoms. So that's why we kind of figure that some people are reacting to it, some people are not, some may have no symptoms, some may have all of the terrible symptoms. So we don't know why it affects exactly which person in what way, but we do know that it is because of the hormonal changes.
That's very interesting. And like I mentioned, the anxiety and the stress and all of that, for a lot of people that goes beyond like normal feelings of moodiness, normal feelings of like something's not right. And I want you to hold on to that thought because I feel like that's a whole different discussion. It's a very big discussion. So let's take a quick break and then come back and then we'll talk about PMDD. So, all of these horrible things that some people feel. I, for example, get super nasty and super irritated right around the time of my PMS. I just feel like everybody's out there to get on my nerves. But you know what gets on my nerves even more is the fact that people mock it, like, you know, like it's not like you're going through something debilitating that you can't control. It's some sort of a joke. Have you seen that?
It's crazy. Like, people make these reels about, oh, my girlfriend's crazy because she's on her period, and she turns into like a rabid dog because I haven't gotten her food, or because I didn't get her something she didn't like, or it just becomes such a big thing. And it's a very easy way to kind of paint us as crazy.
Yeah.
And a lot of times your opinion is not even taken for, you know, it's just like, okay, she's on her period. Maybe she's on her period. Or you lose your temper at something. And this actually happened to me where I was getting very upset at somebody. And in a way I felt was very right because they had really messed up. And all I got was, oh, are you just on your period?
Oh my God, I hate it when people do that.
And I was like, look at the problem. It has nothing to, first of all, do with my period. Second of all, even if I was on my period, that does not mean that I'm yelling at you because I'm on my period. I think that is the worst part about PMS.
It's so patronizing and infantilizing. Like, I am somebody who's unable to... That's the implication. Obviously, I do understand that sometimes people are genuinely saying it in jest, but what it makes me feel when somebody is saying that to me is like, तुम तो बेवकूफ हो, तुमसे तो emotion control नहीं होता है, तुम्हारा hormone गड़बड़ हो गया तो तुमसे emotion control नहीं हो रहा. That's why you're behaving irrationally.
Exactly. Like, everything is just like hormonal problem, hormonal women, hormonal everybody. I think that becomes more scary. So we don't want to even talk about it.
Yeah.
So even if you do have like a bad mood, or, you know, you have sometimes even like a very low mood, or you're having a lot of these mood swings, a lot of times you're just like, I don't want to even talk about it. I don't want to acknowledge it.
Yeah. The minute you say it, they'll be like, hey, iska to PMS chal raha hai. Like it's annoying how much of a bad light it paints us in, like, you know, like we are not capable of taking care of ourselves and our emotions. I hate that. But actually, since we're talking about that, are there any treatment options available legitimately for people who struggle with bad PMS?
So there are a lot of things that we can do, you know, and a lot of them are either alternative medicine or even medicine. But I think if we don't acknowledge it, we don't know what we can do. So for things like dysmenorrhea, which is period pains and cramps, of course we have painkillers, which are completely safe. I have to say this. They're absolutely safe. They do not cause any of these side effects that you've been told. And if anybody ever asks you...
Actually, wait, hang on. I'm so sorry to cut you off. But yes, there is, if you abuse these painkillers, there will be kidney and stomach damage. But when taken in normal amounts for normal period pain, it's fine to take. Please just take it and don't put yourself through that pain. Sorry,
yes, no. And if anybody ever tells you that it causes all of these symptoms, not symptoms, but if it causes infertility and dries up your uterus, you know, just do one thing. Ask them, how does it do that? Because nobody knows how it does that. Because it doesn't exist. Everyone's just like, oh, it causes infertility. How does it cause infertility? What method does it cause infertility? I want to know.
I love it. And then people complain about it ना कि उससे blood flow कम हो जाता है. Like that's somehow a bad thing. Blood flow कम होना तो great है ना.
No, but how?
चलो हो भी रहा है, मान लिया. Hypothetically मान लिया. Blood flow कम हो जाएगा. हो उससे तो flow बंद हो जाएगा.
No, because then they say, because I've heard this, then they say कि blood flow कम होता है तो बाद में fertility ठीक नहीं होता है. Everything is tied to your ability to reproduce children. No, but still,
like women have no other ambition in life other than to have children.
The only way to get at this is to ask them how. How will the blood flow reduce? Tell me how. I want to know what mechanism it takes for this blood flow to reduce.
So, what else can we do for PMS other than like for the period cramps?
So again, for backache, sometimes for insomnia also, we look at giving magnesium. We do look at a lot of supplementation. Sometimes for breast tenderness, we look at vitamin E. You know, there are a lot of things that we can do. Sometimes if it really gets very bad and you do have debilitating manipulating PMS, birth control pills, which are OC pills, are a very, very valid and very, very useful option that, we have to talk about, because I think oral contraceptive or birth control pills have the worst rep in the history of medications.
Yeah.
And honestly, in the history of medications, they're one of the pretty
Most
safe
miraculous.
ones. Yeah.
And most miraculous.
Exactly. And there have been research studies done on millions of women over the last 30 to 50 years. So it's not unfounded that, it's safe. It is safe. The FDA would not have approved it across the world if it wasn't safe. And yes, this is one of the indications of taking oral contraceptive pills is very bad PMS that cannot be controlled, is very well managed by taking the pill.
Extreme period pain, extreme period flow, PMS, PMDD, all of these things that can be so beautifully helped with by OCPs. And like you mentioned, they have some of the worst reputations in the world. And I do appreciate that some people have side effects to one kind of OCP. In that case, we have to remember that this is something I want like everybody to sort of really drill in their heads, is that OCPs are like antibiotics. Just because azithromycin doesn't work for you doesn't mean all antibiotics are bad.
Exactly.
There's different variations, there's different formulations, there's different dosages, and the newer ones are getting so
and they're very low dose. The newer ones are very, very low dose pills. They are mimicking the body hormones. So I think it's getting safer and safer. Symptoms, side effects are getting lesser and lesser to almost minimal side effects at this point. And the best part about this is, if it doesn't agree with you, if you are having any side effects, all we have to do is stop it
and go to a new one, because there's so many different kinds.
Exactly. It's not like a permanent problem. All we have to do is stop, switch, change your dosage, change even the method of, what we're doing. All of those things are wildly possible.
I think OCPs need a new PR firm on their end.
100%.
So actually, on that note, let's take a quick break on this note of PR and come back. And then I want to talk a little bit about OCPs and their role in PMDD, because that's another important topic we do need to chat with you about. Okay, so let's talk about the big elephant in the room. Maybe not the elephant in the room, because nobody knows the name of this elephant except very few people who are in this industry. Let's talk about PMDD. What is PMDD?
Okay. I think this is something that I'm so glad we're talking about, because a lot of times, even a lot of medical professionals are not very comfortable or really know the term so well. Yeah. Because again, a lot of things we have to know is science keeps building and growing and changing, and we're discovering new things every time. So PMDD is premenstrual dysphoric disorder, which basically means very, very bad PMS with a lot of mental health issues that is caused during or around your period in a very, very simplified manner.
Yeah.
So if you have things like unbearable mood swings, if you have severe depression to the point of suicidal thoughts, if you have very severe anxiety, sometimes panic attacks, all of those things during or around your period, which then gets progressively better at the end of your period and then disappears completely and then comes back when you're around your next period, that is then caused PMDD or premenstrual dysphoric disorder.
That sounds horrid.
It is horrid.
Absolutely awful.
And it's really not uncommon.
Yeah?
Yeah.
How common is it?
I think it's about 10% of PMS sufferers. Yeah.
Wow.
Yeah.
That is an incredibly large number for a condition that even doctors... Yeah, I mean, I didn't learn about PMDD until like 2 or 3 years ago. And I did medical school. My mom's a gynecologist. Like, how do we not know? How do we not discuss this?
Even in our gynecology textbooks, PMDD is one paragraph.
So is vaginismus.
Yeah, that's it. It's one paragraph. I did a lot of research on PMDD and how to actually look at managing it, all of that. So I had a patient that walked in when I just started practicing. And she said, a lot of people may not believe me. I've been to a bunch of doctors. I don't know what to do. I know something's wrong, but I don't know. So I, can you just hear me out? I said, of course. And she said that during my period or around my period, I just feel very depressed. I feel very sad. I have end of life thoughts at some point. I'm otherwise not sad. There is nothing wrong in my life. After that, after my period, after I'm done with my period, I feel much better.
Yeah.
And once I get to the time of my next period, again, I start having these thoughts. And then I get so anxious just thinking about this. She was just like, I don't know what to do, but I know something's wrong. I looked online, I Googled it, and, it says PMS, or, I'm depressed. And she's just like, I don't know what's wrong and I don't know what to do.
Yeah.
And that really got me thinking, because if someone comes to you in a situation like that, you know that something's wrong, and you do know that you do need their help. And of course, the first thing I said was, are you seeing a therapist? Are you seeing a psychologist? All of these things. And she said, yes, I'm seeing a therapist, but it's happening only during my periods. And the first thing I could think of was, what if it's PMDD?
Yeah.
But we are told, in medical school that it's so rare and, it never happens. And
I'm surprised you learned about this in medical school.
It was just exam prep, when you're mugging up the answers that you need. But it just felt like, no, it's so rare. How can I diagnose her with that? So I said, I'm going to do some research on this. And that's where I found that it's really not so uncommon. It does happen. All of the symptoms that she talked about were fitting, because she did have some PMS symptoms as well. She did have mood swings. She had breast tenderness, all of those things. And I said, okay, now we diagnose her. What do we do with that? How do we manage her? It's not just, please see a therapist. Because it's not, a lot of it is happening because of the hormones. As we said, PMS happens because of hormonal changes in your body, and your body reacts to it in a different way in some cases. So basically, even if she does see a therapist, gets therapy, it may not change what she's going through, because a lot of what she's going through is not just in her head, it's biological, it's actually happening to her.
It's like if you say somebody has got bad rheumatoid arthritis, and instead of treating the pain, we just say, do more exercises, to limit the amount of pain you have without actually treating the pain. We need to intervene pharmacologically, we need to give medicines, we need to give supplements, whatever's required. So what does one give in PMDD? And again, a quick note, please don't self-medicate. Please speak to your doctor. It's different for everybody. We're just here to talk about what are the options available for people.
And also, please don't self-diagnose also. Because a lot of times, again, sometimes I get patients that say, I have PCOS. And you're just like, no, but, can we look at your history? Can we look at your medical history? Let's look at your symptoms, all of that. So please don't self-diagnose. Please don't self-medicate. But so looking at treatment options for PMDD, a lot of research now suggests a mix of OC pills and antidepressants is shown to be the most ideal way of managing PMDD.
I see.
However, just OC pills is also a great way.
OC pills, woohoo!
Yeah, I know. And or even sometimes just antidepressants. But the latest research shows that if you combine them, they actually have a much better response in patients than just one of the above.
I love that. And I feel like this is such an important conversation to have for people to be able to rephrase that OC pills are not bad. And when I say OC pills, guys, I just want to clarify that these are not the emergency contraceptive pills that you have within 72 hours of having unprotected sex. These are the pills that you take over the month or whatever, however your regime is. They're super, super helpful. They contain regular hormones in very, very tiny doses that help our body function optimally. And for some people, they get side effects. Then we switch you and give you another kind. And OC pills are the bomb.com.
Yeah, really, because I called back the patient and we ran through what she's going through. We ran through her management options. And I said, look, I know there's this bad rep about, OC pills, but I have to tell you this. This is what research says. This is the best way of managing this for what you're going through. I want you to try it. And she did. She's on them for the last year or year and a half now. Very happy with it. She's doing very well.
OC pills,
woohoo! Yeah. And she was on antidepressants as well when we started with her psychiatrist. And yes, I had to actually write a letter to the psychiatrist to say that as her gynecologist, I have diagnosed her with PMDD. This is what she's going through and this is what we've put her on. So, in that way, it helped the psychiatrist, this therapist to also look at it in a more holistic way. Yeah. So I really love engaging other specialties where the need be, because it really helps. I mean, just writing one letter for me was not a big thing, but it'll help her treatment modality to really become something so useful. And that really helped her. The psychiatrist tapered off her antidepressant. She's just on the OCPs now and she's doing really well. And I'm sorry, once again, OC pills, woohoo! For sure. And I've had a couple of patients since then who have been suffering from PMDD. Just a couple. Again, it's not the most common thing, but it is there. It is happening.
It's relevant enough.
It is relevant enough that me as a gynecologist, as one gynecologist, has already treated 3 patients with PMDD. So, it is a number. That is something that we should look at. So, if you are going through this, if any of this resonated with you, please see your gynecologist.
I'm so glad that, we've been able to have the space to have this discussion and talk about it, because these are topics. I mean, the way we learn gynecology in med school, and I'm a very proud doctor, I'm a very proud member of the fraternity I belong to. But unfortunately, the kind of pressure we work and operate under, the only view of women's health we get is bacha related. Pregnancy, delivery, bye-bye, khatam women's healthcare. And there's no space for having these discussions on everyday life, like PMS and PMDD, and how impactful it can be and how much it dictates the rest of your life, what decisions you take, what job you go into, how able you are to maintain your life, your relationships, all of that. So I'm so thankful that you came here and you talked about this, because, this conversation, and a lot of people have requested me to cover this in content, and I just didn't know what to say because we just don't know enough.
Yeah, and and I think what you said about the medical fraternity, medical school, I think, doesn't teach you a lot of soft skills.
Yeah.
Okay. True. And I say this as, again, as you said, a very proud doctor. And med school teaches you a lot of what you need to know, a lot of managing patients, a lot of surgery, all of that is there. And everybody has the knowledge, but the soft skills, I think that is something that, we have to learn on the job.
Absolutely.
Okay. And at the end of the day, we're human. We are all learning.
And it's a very difficult job, I must say.
Yeah, it really is. And, I think we're learning faster now because the world is opening up. We are really being more empathetic because people are also more empathetic towards us. I think it's a hard job because there is no time for empathy or sympathy. There is no time to think. All we're doing is seeing patients, treating them, saving lives, sometimes losing patients. And med school teaches you to not be affected by it. And sometimes because of that, we're just turned off emotionally because you can't let it get to you.
Slightly mechanical. You have to be a little bit mechanical.
You can't let it get to you. But I think we also now are starting to open up a little more to what we're going through. Us and also our patients and women at the end of the day. And I think we also need to get over our biases of minimizing our own health or health in general or mental health, all of those things. So I think things are progressing.
This is so optimistic. And I find it very interesting that these are two often very ignored topics, menstrual health and mental health. And this is just at like if the Venn diagram were to intersect at any point, this is that little intersection. And I'm so glad we were able to have this conversation. Thank you for being here. Thank you for telling us and sharing all of this with us. And this has been splendid.
I'm so happy we did this. And I'm also so proud of you. So that's amazing. But yeah, and please read her book if you haven't. It's so great.
Thank you. Thank you so much.